Good afternoon, New Brunswick, and welcome to today's COVID-19 update for the province. Today we will be joined by Dr. Russell and Minister Shephard. I'm Vicki Hogarth at the CHCO News Desk. We're starting early today at 2 o'clock. I know so many of you are used to a 2:30 start time for conferences, but they do change from time to time. So today will be 2 o'clock. So I hope as many of you are joining us as usual. I'm just going to check in with online right now. There's just over a couple hundred of you already online waiting for it to start. So please feel free to write your questions and concerns. If you are following online on the Facebook page, Shailene from last conference, who was following online with us, actually, one of her questions we were able to ask in the conference, and I did see that it was picked up by many news outlets in the evening about a question about schools and whether or not, now that we are rolling the vaccine back to 18 and up, will it possibly be available to 12 and up before the school year is out? And if so, could we possibly be seeing vaccination clinics in schools? That was Shailene's question, which I asked to Minister Carty, who was in the conference on Tuesday, to which he said it's an idea that they've been thinking about. His concern was that Pfizer has to be stored at very cold temperatures. But since then, as we've seen, there have studies that come out that in Canada are now saying it is safe to store Pfizer at normal refrigerator temperatures for up to a month when you're about ready to actually give out the vaccine. So that's a really interesting development, and thanks to Shailene's question, it's something that is on the radar. So it just goes to show you that if you are watching at home and you do have something that is on your mind or a question you have that's COVID related and we are able to ask it in a conference, you can actually have quite a big impact on the conversation. So Shailene, I appreciate it. You are one of many who has contributed to the questions that we have asked throughout the past year and a bit in these conferences. And honestly, I have them all in front of me on cue cards all the time, and I pivot in the conference based on the news that we hear that day to decide what to ask. Today, obviously, one thing we know we will be hearing about in today's conference is just an update on Zone 3. That's the Fredericton area, and that's where there has been an outbreak, and one with an India variant that we have been following extensively for the past few weeks. Now, obviously, Zone 3 has stayed in the yellow level of recovery, so there's a lot of questions and concerns about whether or not there will be any kind of rollback to perhaps an orange level of recovery or a red level of recovery. That hasn't been something they've considered doing at this time because they've been able to trace all the cases back and link them together. And the work of the contact tracers really determines what they do in terms of making a rollback. If they see that there's community spread on any level, that obviously escalates the concern that public health has and their decision to react in whatever way they decide to react. So I don't know if there will be any news on that today in today's conference in terms of an actual decision being made in a rollback, but I imagine it will be something that is very much addressed in today's conference before the long weekend. Obviously, there's always concerns about long weekend activities and whether or not they will lead to any more outbreaks. Again, we have 51% of all eligible New Brunswickers, that's age 12 and up, who've now had at least one dose of the COVID-19 vaccine. So we are making considerable strides forward in our vaccine rollout, but it doesn't mean that there is a reason at this point in time to step back on any of our initiatives to stop the spread. I'm very excited, though, to be getting my first dose tomorrow at the pharmacy in St. Andrews. So that is definitely, I find like these things are actually emotional experiences when we've been in this for so long together that I'm very much looking forward to my first dose at 11:15 a.m. tomorrow. We should be starting on time today, I imagine. So please, again, I'm reading questions right now on our Facebook page on the live stream that we have going there. If you don't feel comfortable putting your question in the chat bubble so that everyone can see it, you're always welcome to email me privately. There's a news at CHCO.TV is an email address that goes to me and other members of our news team. Also local at CHCO.TV, or you can email me directly at Vicki, VICKI .Hogarth, that's HOGARTH, at CHCO.TV. Now I can hear Bruce in the conference room, so I know that we will be starting in the next 30 seconds or so. So please, while the conference is going on, if you're watching online, please feel free to send me the questions there. But it sounds like we will be starting just right now. 1 second.
Dorothy Shephard,
So
Minister de la Santé.
I'm just waiting for a feed from the province, but we will be heading over to Bruce in the conference room right now. I'll see you after the conference.
Minister de la Santé. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dorothy Shephard, Minister of Health. Dr. Russell.
Thank you, Bruce. Merci. Bon après-midi à toutes et à tous. Good afternoon, everyone. Vous remarquerez que la séance d'information sur la COVID-19 ne se déroulera pas comme d'habitude aujourd'hui. J'y participe à distance aujourd'hui. So you will notice that today we are doing the COVID-19 briefing differently than we have in the past. I am participating remotely from my home today. Students, staff, and household members of a school community were asked to self-isolate for 72 hours. In this particular situation, it's unlikely that I have contracted COVID-19, but I'm following public health advice right now. So, and it is vital that everyone follows public health guidance and advice, and that includes myself, the Chief Medical Officer of Health. Today, we have confirmed another death of a New Brunswicker from a rare post-vaccine complication associated with the AstraZeneca vaccine. A New Brunswicker aged 50 to 59 received a first dose of this vaccine on April 11th and went to hospital with symptoms of a blood clot 17 days later. This individual was previously reported as hospitalized and recently passed away. This is the second death from a vaccine-induced immune thrombotic thrombocytopenia event, VITT, reported in New Brunswick. Thrombosis with thrombocytopenia with unusual blood clots and low platelets is a very rare side effect of this vaccine. And I do offer my sincere condolences to the family and friends of this individual. Nous continuerons d'accélérer nos efforts en vue d'immuniser la population du Nouveau-Brunswick contre la COVID-19. Nous avons franchi une autre étape importante cette semaine. En effet, plus de 52% des citoyens du Nouveau-Brunswick ont maintenant reçu leur première dose d'un vaccin. Un tel taux de vaccination permet d'accroître le degré de protection contre les virus responsables de la COVID-19 et de réduire le risque d'avoir une maladie grave, d'être hospitalisé ou de mourir après avoir contracté le virus. This week, we passed another major milestone. More than 52% of New Brunswickers now have had at least one dose of the vaccine. This will improve the level of protection against COVID-19 and reduce the incidence of severe illness, hospitalization, and death. If we are to prevent further outbreaks and limit the spread of the virus, we must get as many people vaccinated as we can as quickly as possible. We need to use every tool available to us to expand the reach of our vaccination program. The mRNA vaccines produced by Moderna and Pfizer make up the vast majority of the 400,000 vaccine doses we have provided thus far. There are also 43,000 New Brunswickers who received the AstraZeneca vaccine as their first dose. Many of those shots were administered prior to late March, when new evidence about rare post-vaccine blood clots led us to change our vaccination protocol. Nous nous servons maintenant du vaccin d'AstraZeneca pour les personnes de 55 ans et plus, ou dans les circonstances spéciales, quand il est impossible pour quelqu'un d'avoir accès au vaccin par l'intermédiaire d'une clinique, d'une régie régionale de la santé ou d'une pharmacie. Les risques associés à ce produit sont rares, mais ils existent, comme nous le constatons aujourd'hui. We now use the AstraZeneca vaccine only for persons 55 and over, and mostly in special circumstances where an individual is unable to access a vaccine through an RHA clinic or pharmacy. The risks associated with this product are rare, but they are real, as we have seen today. But there are also benefits that come with being fully protected against severe illness, hospitalization, and death from COVID-19. Last week, we announced we could not widely use the AstraZeneca product for new first doses to the general public. But for those who had this vaccine as their first dose, there is an opportunity to get it as their second dose before the end of the month. Nous avons annoncé la semaine dernière que nous ne servirons plus du vaccin d'AstraZeneca pour administrer une première dose au grand public. Cependant, les personnes qui ont reçu leur première dose de ce vaccin pourraient recevoir leur deuxième dose avant la fin du mois de mai. The province currently has about 3,500 AstraZeneca doses, which will expire on May 31st. We would prefer to provide this product to use for protecting people who understand the risks and benefits of this vaccine. Obviously, if we aren't able to use it by May 31st, then the doses would have to be disposed of. New Brunswickers who are 55 and older who had AstraZeneca as their first dose at least 8 weeks or more ago can request a second dose of this vaccine. You can register online for an RHA clinic or contact a participating pharmacy that has doses of this vaccine in stock. Be informed and consider the risks and benefits. Si vous décidez de ne pas recevoir le dose de rappel d'AstraZeneca, vous pouvez attendre afin de recevoir une deuxième dose d'un autre produit jusqu'à 16 semaines après l'administration de votre première dose. Nous nous attendons à recevoir prochainement des directives du gouvernement provincial sur l'utilisation d'une sorte de vaccin différente pour la dose de rappel. If you decide not to take AstraZeneca as your second dose, you can wait and get vaccinated with another product up to 16 weeks after your first dose. We expect to soon receive direction from the federal government on using another vaccine product as for the second dose. Aujourd'hui, Santé publique annonce qu'il y a 15 nouveaux cas de COVID-19 au Nouveau-Brunswick, dont 3 personnes à l'extérieur de la province. Il y a un nouveau cas dans la zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick. Ce cas fait toujours l'objet d'une enquête. Il y a 9 nouveaux cas dans la zone 3, soit la région de Fredericton et de la vallée de la rivière Saint-Jean. De ce nombre, 5 sont des contacts de cas confirmés, 3 sont directement liés à un voyage et un fait toujours l'objet d'une enquête. Il y a 4 nouveaux cas dans la zone 6, soit la région de Bathurst et de la péninsule acadienne. Tous ces cas sont liés à des voyages et 3 d'entre eux s'isolent à l'extérieur de la province. Dans la zone 7, soit la région de Miramichi, il y a un nouveau cas à signaler aujourd'hui, soit un contact d'un cas déjà confirmé. Il y a présentement 127 cas actifs de COVID-19 dans la province. De ce nombre, 17 sont des citoyens du Nouveau-Brunswick qui ont contracté le virus ailleurs et qui s'isolent à l'extérieur de la province. Il y a présentement 7 citoyens du Nouveau-Brunswick à l'hôpital après avoir contracté la COVID-19, dont 3 aux soins intensifs. Une de ces personnes est hospitalisée à l'extérieur du Nouveau-Brunswick. Today, Public Health has confirmed 15 new cases of COVID-19. This includes 3 cases that occurred outside New Brunswick. There is 1 case in Zone 1, which is Moncton and the southeastern New Brunswick area. This case is under investigation. There are 9 new cases in Zone 3, which is Fredericton and the St. John River Valley. 5 of these are contacts of existing cases, and 3 are directly related to travel, and 1 is under investigation. There are 4 new cases in Zone 6, which is the Bathurst and the Acadian Peninsula area. All of these cases are related to travel, and 3 of them are currently self-isolating outside of the province. In Zone 7, which is the Miramichi region, there is 1 new case today, which is a contact of a previously known case. There are now 127 active cases of COVID-19 in the province. This includes 17 New Brunswickers who contracted the virus elsewhere and are self-isolating outside of the province. We now have 7 New Brunswickers in hospital, including 3 who are under intensive care. 1 of these cases is hospitalized outside of New Brunswick. And I ask again that you keep all of these New Brunswickers in your thoughts and prayers as you go about your day. So the situation in Zone 3 does remain concerning. And in addition to the 61 active cases in this zone, we have seen potential public exposures at dozens of locations around Fredericton and surrounding communities. We are continually monitoring the situation and the trajectory of the virus, which appears to be primarily the B167 variant first reported in India. So there are at least 3 sub-variants of this strain now in circulation globally and in Canada. And in New Brunswick, we are experiencing the second clade of the 3 different clades of this particular variant. And what we do know is that the variants can behave differently compared to the original strain of COVID-19. And while the virus is generally transmitted through droplets, etc., it can be contracted by touching something that has the virus on it and then touching your mouth, nose, or eyes with your unwashed hands. So as of now, we are keeping zone 3 at the yellow alert level. But as I have said before, this can change literally overnight. We are seeing more transmission with the variants compared to the COVID that we saw before Christmas. We've learned so much about variants. Our experience in Zone 4 has given us a lot of information around the UK variant, as well as the South African variant. And now this will be our second cluster of cases related to the India variant here in Fredericton. So we're definitely learning more and more with each outbreak. To date, we have not imposed stricter measures like those used in the recent outbreaks in Zone 4 because the virus has been spreading within close contacts and mainly to those already isolating, so members of people's households for the most part. But we have seen other types of transmission where people were in public spaces as well. However, we have not seen community transmission at this point in the Fredericton area. So far, we have been able, through contact tracing, and our contact tracers are amazing. They have been doing fantastic work, so kudos to them. We could not succeed with containing these clusters without their help and without the cooperation of the public. So the contact tracers have been able to establish links between virtually all the confirmed cases in Zone 3, again, with the help of our medical officers as well as our epidemiology team. Again, fantastic collaboration, really, really amazing. So we're going to show you a slide now. And this image is illustrating the case cluster, which is now active in the Fredericton area. And each dot represents a single case with lines that connect it to other confirmed cases. And you can see that there are lines that connect almost all the cases to the others in the cluster. And what you'll also see is you'll probably see the individual cases that are directly new imported cases that are recent travel related. Now, this is in contrast to what we saw during the Edmundston outbreak in March and April, where there were several distinct clusters of cases along with many dots that had no connection to any existing cases, and we couldn't trace it back to travel. So again, we're watching Zone 3 very, very closely. I mean, we're talking hour by hour as new cases come in. We are figuring out, is it a new travel related case? Is it related to the cluster? If it is related to the cluster, how is it related to the cluster? And what types of risks do we need to manage because of these new cases? Si la situation s'aggrave au cours de la fin de semaine, c'est-à-dire s'il y a des signes de transmission communautaire ou si le nombre de cas augmente en flèche, nous n'hésiterons pas à passer à l'action. Si c'est le cas, nous ne prendrons pas des demi-mesures. So if the situation were to worsen over the weekend with evidence of community spread or a significant spike in cases, we would not hesitate to act. So I hope this does not prove to be the case, but again, we are following things extremely closely. So we are entering into a holiday weekend, and we do know from past experiences that this could lead to further spread of COVID-19, and we don't want to see that. So definitely unnecessary travel is discouraged. Nous entamons cependant une longue fin de semaine et nous savons par expérience que cette situation pourrait faire propager davantage le virus responsable de la COVID-19. Et j'exhorte donc tous les citoyens partout dans la province à continuer à suivre les consignes de santé publique comme ils le font depuis 14 mois. Continuez à porter un masque en public. Restez à une distance d'au moins 2 mètres des autres. And I urge everyone in every corner of our province to continue to follow public health guidance as you have diligently done for the past 14 months. Continue to wear a mask in public places. Maintain 2 meters of physical distance from others. Wash your hands regularly and thoroughly. Make frequent use of hand sanitizer between washing to remove any viruses you might pick up. If you feel unwell, please stay home. If you have been in a place where there has been public exposure, please get tested, and please get tested even if you have mild symptoms. We have found cases when there have been public exposure notifications. So we do pick up some cases that way, and that way we are limiting the further spread of COVID. And if you are told by public health to self-isolate, please follow their instructions closely. Businesses need to continue to follow public health measures as well. We have encountered during contact tracing that some information where we don't have accurate information on individuals in restaurants and areas where individuals may gather hasn't been provided. And this is a challenge for the contact tracers. So people, when you are out and about, give your correct phone number, your correct name, etc., and the members of your party. It is really important for our contact tracers to be able to do their job. So make sure that that everybody does their part. And certainly, if you haven't signed up for a vaccine yet, please do so. We are definitely on a great trajectory with respect to vaccinating people in our province. So I am really looking forward to as many people as possible getting vaccinated. So we know that everybody is tired of COVID, but COVID doesn't get tired. And so we continue to see what happens with the variants. We continue to learn. And now more than ever, we definitely need everybody to continue to follow the rules and work together to get us through this last stage of our pandemic journey. Thank you very much.
Good afternoon. Bonjour. On behalf of all New Brunswickers, I would like to share my sincere condolences with the loved ones of the person who passed away as a result of a blood clot associated with the AstraZeneca vaccine. As Dr. Russell explained, this type of reaction is rare, but there is still a heartbreaking loss for a New Brunswick family. My thoughts and prayers are with them during this difficult time. Over the past few weeks, we have made incredible progress in our vaccine plan. As of today, 52.6% of our population, aged 12 and older, have received at least one dose of the vaccine. Day after day, we are reaching new records for the number of people who have received their shot. Yesterday, 13,751 doses were administered, which is a one-day record for our vaccination rollout. As of this morning, New Brunswick has had the highest percentage of people vaccinated in the Maritimes. And to date, 77% of New Brunswickers over the age of 50 have received at least one dose, and many more people have upcoming appointments in the days ahead. These are great achievements, and we can all be proud of the progress we have made thus far. The finish line is in sight, but we are not there quite yet. We need to continue to focus on making sure as much of our population as possible is fully vaccinated before we can let down our guard. At this time, everyone aged 18 and older is eligible to receive their first dose. I encourage anyone who has not been vaccinated to sign up for their appointment right away. The process is easy and straightforward. You can contact a participating pharmacist to book an appointment, or you can visit www.gnb.ca/book-a-vaccine to receive your vaccine at a Horizon or Vitalite Health Network clinic. We have many appointments available in all regions of the province. I'm confident everyone can find an appointment that works with their schedule. If you do book an appointment, please show up at the time you have scheduled. We've heard some reports of people booking appointments, but then finding an earlier time slot, and failing to cancel their original appointment. Please be respectful of the pharmacy and regional health authority staff who are working hard to ensure everyone is vaccinated in a timely manner. If you are unable to make a scheduled appointment for any reason, please cancel it in advance. It is important that all New Brunswickers do their part by getting vaccinated as soon as possible to protect themselves as well as everyone around them. But it is especially vital that long-term care workers get vaccinated if they have not already done so. As of today, 67.2% of long-term care workers had received their first dose. I want to thank every long-term care worker who has stepped up and received their vaccine. As we know, the residents living in our long-term care homes are particularly vulnerable to COVID-19. Even once they are vaccinated, this population is still at some risk of contracting the virus. I implore long-term care workers to think about the health of the people they care for every day. Residents and staff who have not yet received a first dose of the vaccine are now able to register as part of the second dose clinics taking place at long-term care facilities around the province. Additionally, long-term care staff may also register for vaccination at one of the 218 participating pharmacies in the province or at clinics provided by the Horizon and Vitalite Health Network. Please take the time to get vaccinated. Do it to protect yourself and your family, as well as the vulnerable residents who are relying on you. We are approaching the Victoria Day long weekend, which is the unofficial beginning of summer for many of us. I hope everyone has the opportunity to enjoy this long weekend, but please do so safely. For now, the entire province remains in the yellow alert level. This means we must maintain a safe physical distance from others in public, and we must wear a mask in indoor public spaces. It also means that businesses, including restaurants, can stay open, and we can all spend time with people in our steady 15 list of contacts. We are fortunate in New Brunswick that we can enjoy this level of freedom right now, while other provinces remain in lockdown to combat high case counts. But there are still rules in place, and we must continue to follow them to keep the entire province yellow. As Dr. Russell explained, Public Health is closely monitoring the situation in Zone 3 and across the province. If we see outbreaks with community transmission, if we see a significant rise in the number of hospitalizations, or if we see that large numbers of people are not following the rules, we will not hesitate to change the alert level. Right now, we're not seeing any evidence of this taking place in Fredericton or elsewhere. But as we all know, the situation can change quickly. We will continue to listen to the advice of public health, and stricter rule regulations will be introduced if needed. New Brunswick is doing so well. With our vaccine rollout, we have continued to demonstrate that our province is a leader in responding to the pandemic. Now, we just need to keep up the great work for a little bit longer. Please continue to follow the rules and protect yourself and your loved ones by getting vaccinated as soon as possible. Thank you. Merci.
Thank you, Minister. Thank you, Dr. Russell. Merci beaucoup, Madame la Ministre et Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans les langues officielles de votre choix. Chaque journaliste aura une question et un suivi très rapide. Voulez-vous assurer de désactiver le son de vos micros? Ladies and gentlemen, we'll now proceed with questions from members of the media. Each reporter will have one question and the quickest follow-up. You have the right to pose your question in the official language of your choice. Please ensure all your microphones are placed on mute. Kevin Bissett, Canadian Press.
Good afternoon for Dr. Russell. Dr. Russell, we've heard all along that the spread of COVID-19 is airborne, but now we hear the spread at McGee House and the Delta Hotel may have been off surfaces. Can you explain that conclusion, and is it more prevalent with the variants?
Well, Kevin, I was reviewing some of the documentation from Public Health HD of Canada on this, and really there's not really a change in the different ways that we know that COVID can be transmitted. But I think what's different with the variants is that it's just exaggerated. So, what we're seeing is just more transmission. So more close contacts are getting infected within households. If people have been in a certain area, not necessarily even at the same time, and touched surfaces or been in a space where somebody else with COVID was, we saw transmission that way. And the thing about what our conclusions are or not, and our hypotheses, is about using whatever information we gain from each outbreak to inform how we approach the next outbreak. So what we learned from McGee House at UNB was that the transmission was happening between apartments, between people who lived in apartments that didn't know each other, that didn't have any contact with each other, were not in each other's households. But once everybody was isolating within their apartments, we didn't see any further transmission. So we're just trying to be as cautious as we can as we learn about the transmission of the variants. We know even at the national level, when we have conversations with our colleagues, our chief medical officers of health across the country, we are actually looking at new case definitions and case management approaches for the variants right now. Again, we're just trying to take all the information that we can to improve our approach as things evolve.
Thank you, Doctor. Mr. Bissett, do you have a quick follow-up?
I do, and I guess with that knowledge, should we be taking any other precautions, such as wearing gloves?
Well, I think the advice, and again, I've spoken to Dr. Gordon Dow about this, is that all the measures that worked prior to the variants in terms of hand washing, hand hygiene, disinfecting surfaces, using alcohol sanitizer, keeping our physical distance, wearing masks, is still really important. I think we have to be more aware of those types of things and be more conscientious of them. And just, again, it's just because the transmission that we're seeing is so much more, like, let's say, between 30 and 70% more transmissible, so more contagious. So whatever we were doing before with the old COVID, we have to keep doing and really be conscientious about it.
Thank you, Doctor. Thank you, Mr. Bissett. Have a good weekend, Kevin. Clara Pasica, Times and Transcript.
Good afternoon. So this week, seasonal residents, as well as those with family members in Prince Edward Island, received news that they would be allowed to return using a staggered approach with several measures in place beginning June 8th. Now, seasonal residents and those with family in New Brunswick longing to see things like 90-year-old relatives and things like that have been writing to the government, and they've also been writing to us saying that there's no news at all about what will be happening for those looking to return. What conversations is the government having at the cabinet table and also with public health about the rollout of something like this that would facilitate that happening for reunification and for people to return to their properties?
Thank you for the question. So I can't talk about the cabinet table, but what I can tell you is that the Department of Health with Public Health will be making recommendations to cabinet and COVID cabinet very soon. It's imperative that we get a little bit more of our population vaccinated, and ideally to that 75%. 75% of our population 12 years of age and older before making the jump. We're not that far away from it, and I appreciate everyone's excitement and and concern about trying to get here to see family and loved ones. So we're not quite there yet. As you know, we also have a different process than most provinces. We don't just have government making these decisions. We have a COVID cabinet committee where we collaborate with our opposition leaders and then bring forward those suggestions to cabinet. So it's not going to be much longer before some of those parameters are defined, and if we're lucky, maybe next week I get to tease out some of what's going to happen in our near future that will open us up and show our path to green.
Thank you. Ms. Pasica, do you have a follow-up?
So to be clear, sometime next week, the announcement of a plan related to how seasonal and family will be able to return is when news of that can be expected?
No, it's coming in the near future over the next couple of weeks. And, as I said, I might be able to tease out a couple of potential details next week, but we'll see.
Thanks.
And Todd Battis, CTV.
Thank you, Bruce. This is for the minister. I'd like to ask a question concerning the neurological disease. We've been hearing from patients and families who are frustrated by lack of communications with public health. I'm wondering if you can give some indication of where patients may be hearing from somebody within public health about their cases.
So, as you know, we have been establishing a clinic with Dr. Marrero leading that, and we're also putting together a neurological team to support him of neurological specialists. It's really important that when we do begin giving information, that it's the correct information that our specialists who are working on this have deemed appropriate. There is no information being held back. The work with interviews is going to start next week. This is going to be extensive work that we need to get completed. The questionnaire that families and or individuals who have this illness are going to be is going to be extensive, and there may be even a second questionnaire that may happen secondary to that will be more focused. There is absolutely nothing that has been taken off the table other than Creutzfeldt-Jacobs disease. That's the only one we know is not applicable here. So this is research, and it is science, and it is medicine, all rolled into one. It is methodical, and we put the supports in place to support the medical professionals in helping guide us through this process. I expect that families will be contacted next week for consent and to move on with the interview process.
Thank you, Mr. Battis. Do you have a follow-up?
Just quickly, thank you. Is there any consideration being given to updating the website with some of the work that's being done by public health?
We will. I don't know that there's much more information to transmit other than what we've already told everyone, but absolutely, I'm sure that I will have them do that.
Thank you, Mr. Battis. Have a good weekend. Silas Brown, Global.
Thank you, Bruce. Hi there. This is for Dr. Russell. I know there's been some talk about potentially seeing a roadmap for reopening coming next week. But I'm wondering, just from a public health standpoint, what are the major milestones that are going to be kind of form some of the basis of when we can begin to loosen certain things up?
He's got to speak closer to his phone.
Great question, Silas. So basically, I think all jurisdictions in Canada are looking at similar things in terms of positivity rates, hospitalization rates, ICU admissions, case numbers, and I think obviously vaccination rates. So all of these things are going to play a huge role in how we move forward together within Canada, but also within the Atlantic provinces. As you know, the Atlantic provinces have done things slightly different than the rest of Canada throughout the pandemic. So I think based on what Minister Shephard said as well about recommendations that we'll be bringing to Cabinet, we'll have more information on that in the coming days and weeks.
Thank you, Doctor. Mr. Brown, do you have a follow-up? And can you talk a little louder, please? Thank you.
Yeah, sure thing. I'll yell a little louder on my own here. This is for either the minister or Dr. Russell, whoever wants to talk about this one. But just how critical, is this coming weekend and really, getting the situation in Fredericton really under control to getting out that rollout plan, that reopening plan that we could see in the coming weeks here.
I'll take that one. I can't stress enough how important any long weekend is when we have a holiday weekend with our COVID reality. And so, keep to your family plus 15 bubble. Follow the rules when you're out in public. Wash your hands, wear your mask, keep your social distancing when necessary, when you're not with your bubble of 15. And and be diligent. This is about getting through the next so few weeks to get us on a path that everyone is waiting for. Provide the right contact information when you're visiting businesses. And as importantly, the message to businesses has to be, follow your operational plans. I know that this has been a tough time, but we need you to be part of the solution in helping us get on a pathway to opening.
Sure, thank you, Mr. Brown. Have a good weekend. Bobby Jean McKinnon, CBC.
You're visiting businesses. And yep, sorry about that. Dr. Russell, the public is notified when there are positive cases in schools. Why wasn't the public notified about the positive case at Chancery Place? Shouldn't any visitors to the building and contacts of contacts be made aware as soon as possible so they can possibly alter their behavior and watch for any symptoms?
Great question, Bobby Jean. So what happens at Chancery Place is it's quite a tightly controlled building. So you cannot actually get into the building unless you have a pass that is electronic, or you sign in. And so we have the names and contact information for every single person who comes in and out of Chancery Place. And so with respect to contact tracing, if we didn't have all that information, then absolutely there would be a public notification, a public exposure notification, because we wouldn't be confident that we could contact everyone who needed to be contacted. So public health, because they have access to all of that information, can contact anybody who would be at risk and give them information that they can use individually.
Thank you, Doctor. Ms. McKinnon, do you have a follow-up?
Yes, on that same issue, though, as you discussed, the health officials believe that the source of transmission in the Delta cluster and the UMB case is probably contact as opposed to aerosol. So how confident are you that people in Chancery Place, other than close contacts, weren't exposed?
Great question also. And again, time will tell as we learn more with each and every case that we're dealing with. But certainly with both the UNB and the Delta linked cases, they're not exclusively transmitted in that particular way. Again, we're seeing household members are the highest risk, obviously, of anybody who has COVID-19. And the transmission is usually through close contact. But there is a visitor log available with respect to the Chancery Place linked case. And again, they do have cleaning protocols, et cetera. And if something pops up where, the close circle of people associated with that particular case may or may not have been tested. So that's the other approach, coming back to Kevin Bissett's question about how we proceed with the management of cases. What we learned throughout the pandemic, starting early on, was we would go back, contact trace 24 hours before somebody became symptomatic. Then it was 48 hours. Now it's 72 hours. So as things have evolved, we've continued to evolve with COVID-19. So at this point in time, some close contacts of cases would actually be asked to be tested right away. The contacts of contacts are being asked to isolate and their household members. So that would be taking place with the Chancery case as well. And if by chance something did pop up that we weren't expecting, again, we have all of the people that we need to get in touch with in terms of providing that information to them.
And I'll just add for that is that, as Dr. Russell said, Chancery Place is a pretty controlled building. Access to it is not happening in a random basis. And so employees were contacted. The case, we believe, we're very confident did not originate at Chancery. And there was additional cleaning done, and all of those parameters for good public health measures were followed. And as Dr. Russell said, when you know who all the contacts are, you don't have to put out a public acknowledgement. Many of the restaurants that that may have been named in the past is probably due to the fact that people aren't necessarily giving accurate information. And so if we can't contact them, we have to try to make them aware of situations. So that's what it is.
Thank you, Minister. Thank you, Ms. McKinnon. Have a good weekend, Bobby Jean. Aaron Sousa, Huddle Today.
Thank you, Bruce. This question can either go to Minister Shephard or Dr. Russell. With the campgrounds opening today and, this cluster of cases in Fredericton, along with the rest of the province, is there any sort of concern about how New Brunswickers will be able to enjoy the long weekend?
Well, I think New Brunswickers can enjoy the long weekend really well, maybe aside from some of the weather forecasting. But the fact is you have a household bubble plus 15. And, there's a pretty good chance that that's going to be enough for people to really enjoy themselves. But at the same time, and I hate to be a downer, but operators of these campgrounds have an operational plan in place. It's their responsibility to ensure that people are using the grounds properly and that they're not having any large gatherings without having a proper operational plan in place.
Dr. Russell?
Yeah, and I'll just add that, between now and the next several months, we will still count on people to continue to get tested if you've been to a public exposure site, continue to get tested if you've had symptoms, stay home if that's the case, and get vaccinated. So those are the things that people can do over the course of the next several weeks and months to maintain our status of having low case counts and having low cases in hospital, et cetera.
Thank you, Doctor. Aaron, do you have a follow-up?
Yes, thank you. Sort of going off of that one, I understand that the Paddlefest Music Festival is happening this weekend in St. Andrews, and many Zone 3 artists are playing over the weekend with St. Andrews being in Zone 2. So the festival hasn't been canceled, and to my understanding, none of the Zone 3 artists have either. So is there any sort of message for these artists? Should these artists travel from Zone 3 to 2, and what do you think should be done? Thank you.
Well, these any kind of outdoor activities have an operational plan. And so as long as they stick to it, they're following the rules and we're minimizing risk. We want people to enjoy themselves and enjoy the artists that are performing, but it's all dependent on that operational plan.
Thank you, Minister. Thank you, Doctor. Thank you, Ms. Sousa. Have a good weekend. Vicky Hogarth, CHCO.
Thank you.
Thank you, Bruce. Dr. Russell, what do you know about the black fungus infections tied to the India variant that seem to be happening in other parts of the world, sometimes 12 to 15 days after recovery? Is it something New Brunswickers who've contracted the India variant should be concerned with?
I have done some reading around that and actually looked at what those risks are, and based on some email traffic as well with some of our infectious disease specialists and micromed physicians, that particular fungus is endemic in India, and definitely they have seen, with their large numbers of cases and people who are very severely immune compromised, either people that are on prednisone or have diabetes, et cetera. So there are some heightened risks in their population, again, around the fact that it's a fungus that's endemic there. And they were seeing it in cases of COVID-19 in people who were very immune compromised. And I don't expect to see it here, but certainly we are aware of it.
Thank you, Dr. Joe. Follow-up, Ms. Hogarth?
Yes, thanks, Bruce. It's just for some clarity on AstraZeneca doses. If you had your first dose of AstraZeneca, did you say you can now book a second dose appointment for Pfizer and Moderna if it's been 8 weeks or more since your first dose?
No, I don't believe that's what I said. We'll get you clarity here.
Yeah, I think it referred to in my notes as well, but
I apologize. I should remember right off, but the end of a long week. Can't find it.
Yeah, I think I have it, Minister.
Thank you.
Oh, except my video camera is not working as well now. If you decide to not take the second dose of AstraZeneca, you can get vaccinated with another vaccine product up to 16 weeks after your first dose.
Thank you, Doctor. Thank you, Minister. Have a good weekend, Ms. Hogarth.
Thank you.
Laura Brown, CTV.
Hi there. I'm wondering if you have, because of the, I guess, expedient nature of the vaccine rollout at this point, have you considered lessening the time frame between the first and second dose at this time? Like, when can people start to book their second dose?
So we've already.
Do you want me to take?
Oh, go ahead, Dr. Russell. Your screen's back.
It's okay. You go ahead.
Well, yeah. I know that we've already had medical professionals who've had second doses, long-term care facility workers who've had second doses, and so those are going to be rolling out in a more of a mass way after we finish those first doses, and we're looking at that for around the first week of June, around the week of June 7th. So the second doses, we got to keep rolling. So if people are ready for their second doses, we'll be booking them. It'll depend on when they got their first.
Ms. Brown, do you have a follow-up?
I'm also wondering if there are any other investigations or anyone else suffering from what you believe is this blood clot disorder after the AstraZeneca vaccine.
So take that.
I am not aware of any other investigations at this time, but we do have a team that works on these issues, and we do have a report that's generated once a week around all adverse events.
Thank you, Ms. Brown. Have a good weekend. Jean-Philippe Hughes, Radio-Canada.
Oui, bonjour. C'est une question pour Dr. Jennifer Russell. Il y a des gens qui trouvent qu'on était plus rapide à tirer sur la cachette pour faire passer une phase jaune à une phase orange dans les zones 1, 2 et 4 dans les derniers mois. Pourquoi est-ce que vous attendez dans la zone 3 alors qu'on a un long week-end qui s'en vient et vous l'avez vous-même dit, ça risque d'occasionner des réunions familiales et des déplacements dans les différentes zones sanitaires?
Oui, c'est une bonne question. L'analyse qu'on fait chaque jour, presque 2 fois par jour, ou plus que ça, c'est vraiment analyser toutes les choses qui sont des risques au niveau des nombres de cas, particulièrement ceux qui sont liés pas l'éclosion, mais les cas qui sont liés au Delta, puis la continuation de cette transmission, cette chaîne de transmission. On ne voit pas la transmission communautaire et on ne voit pas, il y a toujours un pourcentage des nouveaux cas qui sont des nouveaux cas liés au voyage récent. Alors c'est une situation un peu différente au niveau il n'y a pas des éclosions qui sont dans des foyers de soins, des résidences à long terme à ce moment-ci. Et on est dans une différente partie de notre déploiement de tous les vaccins. Alors, c'est ça. Pour l'instant, on va continuer à surveiller très, très, très prochement la situation.
Monsieur Hughes, as-tu un suivi?
Oui, c'est au sujet de l'hôtel Delta de Fredericton. C'est une question en 2 temps. J'aimerais savoir, on est rendu à combien de cas associés avec le Delta, mais surtout, le graphique que vous nous avez montré tout à l'heure avec la très grosse grappe, est-ce que l'origine de cette grappe-là, c'est bel et bien le Delta de Fredericton?
Oh, je n'ai pas compris la dernière partie de votre question.
Plus fort, Jean.
Oui, je vais parler plus fort. Excusez-moi. La deuxième partie de la question, c'était par rapport au graphique que vous avez montré tout à l'heure avec la très grosse grappe de cas. Cette grosse grappe-là, est-ce que son origine, c'est le Delta de Fredericton?
J'ai pas le graphe devant moi à ce moment-ci, mais je sais que ceux qui sont liés, originalement, il y avait environ 10 cas directement liés au Delta, soit quelqu'un qui a resté là ou a mangé au restaurant, ou c'était des staffs. Alors, il y avait 10 cas liés directement au Delta. Et après ça, c'était soit les gens qui demeurent dans la maison avec les cas ou quelqu'un qui a transmis à des contacts étroits en hors de la maison.
Tom Bateman, Brunswick News.
Thanks, Bruce, and happy Friday. Dr. Russell, for people who've had their first dose of AstraZeneca and have not seen any side effects relating to the blood clot, should they have more confidence that they have less of a risk or no risk of blood clots with their second dose of AstraZeneca? Should they have more confidence that they pick their second dose of AZ?
Hi, Tom. So the information continues to evolve. The last part, some of the information that we received was that the risk of having complications with the second dose related to thrombocytopenia and thrombosis is 1 in a million. But, that could change as more second doses are given. So we're going to keep monitoring that, and we will provide that information to people who are getting their second dose with informed consent. So again, we are continuing down the path of giving second doses to people 55 and over, and for people who are homebound. But again, the federal government is providing us information around having a second dose with an mRNA product if they so choose.
Thank you, Doctor. Mr. Bateman, do you have a follow-up?
Yes, on a different topic. I just have a question about the logistical issues related to an in-school vaccination program. Can you explain the difference between New Brunswick's circumstance and PEI, where they, I believe, are moving forward with vaccinating middle schoolers in their schools, next month?
Well, go ahead, Minister.
Well, I can just say that I the details are still to come. We're working closely with the ECD on the logistics of how we could roll it out as smoothly as possible. Dr. Russell may want to weigh in on some of those logistics.
Well, we have a vaccine task force that is working on the rollout with EECD. So I don't think the details are completely finalized yet, but the plan will be to vaccinate kids, but the how and where and those pieces are being worked on by the vaccine task force.
That concludes today's COVID-19 update for New Brunswick with Dr. Russell and Minister Shephard. Just for a quick recap, there were 15 new cases of COVID-19 in the province today. One of those cases was in Zone 1, 9 were in Zone 3, that's the Fredericton region, 4 were in Zone 6, and 1 was in Zone 7. There are 127 active cases currently in the province. Now, the breakdown for that is there were 15 in Zone 1, 19 in Zone 2, 61 in Zone 3, 4 in Zone 4, 1 in Zone 5, 22 in Zone 6, and 5 in Zone 7. We also did hear reports that the second New Brunswicker has died as a result of the rare blood clots from the AstraZeneca vaccine, and 52.6% of New Brunswickers who are eligible over age 12 have received at least their first dose of the vaccine. I'm Vicki Hogarth at the CHCO News Desk. Have a great long weekend. I look forward to joining you next time.
A news and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.